We're all human. And it's important to know that doctors are people too. Doctors have emotions, they have passions in life and hobbies, and they enjoy participating as active members in the communities where they practice medicine. Doctors have families, friends, and relationships. While the latest in healthcare and the most current treatments for ailments will be topics on this Doctors Are People Too radio TV show, the focus will be in learning more about the interesting aspects in a physician's life and what they do away from the doctor's office or operating room table.
Hello, South Florida and beyond, and globally on the iHeartRadio app. Welcome to Doctors Are People Too. And I'm so glad to have in the studio tonight Dr. Vivian Carta-Sanchez. And she is a doctor of nurse practitioner, and I'm probably butchering a few things early, and we're going to talk a lot about that. But she is a ARNP and DNP, and her areas of interest are in internal medicine, geriatrics, holistic well-being. Dr. Vivian Carta-Sanchez, how are you doing tonight?
Good. Thank you very much. Thank you for having me.
And thanks for coming on Doctors Are People Too. I really appreciate it because we have a lot of doctors on the program, and you're a doctor as well, but we never get to explain the DNP and Doctor of Nurse Practitioner. I think that's so important because whether you're driving around South Florida or you see us later on, an internet link, is something that I've always been confused about a little bit. And I think I'm like the general guy out there. I pretty much fit that demographic. So let's get right into it. We are going to touch on internal medicine, geriatrics, and holistic well-being. So stay tuned. But so you are a doctor. Let's get that out there first, correct?
Yes, yeah. I have a doctorate degree in what is the nurse practitioner. And it is different from being in just an ARNP, because we have, 2 or 3, depending on what your program allows, another 2 or 3 years of school, which allows us to get that final degree in our discipline, which is nursing. And we are the new kids on the block in the sense that you probably haven't heard a lot about us in the last 5 years. You start hearing about those initials, DNP. So it is something that a lot of people definitely have confusion about. But I'm here to tell you, there's a lot of us, we are a new number that's going to be coming, something that you'll recognize. And we are the new kid on the block in the sense that we are seeing ourselves as primary care providers, along with physicians, along with physicians' assistants. We are definitely the new kid on the block with that degree. But we provide the kinds of services that many physicians do. But we come from a nursing background, so I hope that says something a little bit. It explains a little bit for you.
No, that's perfect, and I'm gonna even delve a little deeper. We're here with Vivian Carta-Sanchez, ARNP, DNP, with Tenet Florida Physician Services. Her office is located at 5405 Okeechobee Boulevard, Suite 100 in West Palm Beach. The number is 561-697-3131. And she's on the website tfpsdocs.com. That's tfpsdocs.com. Now, I got to go a little bit deeper because the first credentials you have after your name are ARNP. And I'll be honest with you, the only one I knew was the NP was nurse practitioner. So let's start with there. What is an ARNP?
Okay, the initials actually stand for Advanced Registered Nurse Practitioner. So it's advanced nursing, basically. We were the profession was actually developed back in the 50s, 60s, really, as an effort to provide primary care services for people out in the rural areas where doctors weren't around. So a group of very smart entrepreneurs, one being a nurse, her name is Loretta Ford. She actually came up with this idea that why don't we train nurses to become providers where they could actually, diagnose, prescribe, follow through with treatment plans, and give them that ability to have the knowledge base to provide that kind of service so that more people can be served. And it took off then in the I believe it's in the 60s. Loretta Ford continues to be around. So I was just at a conference, which unfortunately due to the hurricane, she could not provide us with a discussion. But she's still very active in providing the voice for nurse practitioners around the country. So we are, providers of primary care, usually, and you'll see us also in specialty care. My love and passion more is for primary care. That's where I get more of a connection, and I get more of my enjoyment is to treat people from the first level of care, which is primary. And that's where you come in with, colds, coughs, where you get a wellness check. We tell you where you think you might have some improvements on your health. We'll tell you not to smoke. We do all these things to kind of keep you healthy and well. So that's our focus. And we look at the whole person, which is what we are strong as a nurse. We're always about people and relationships and exchanges. So our point of view maybe is a little bit more of a relationship type of building when we have a meeting with a patient or a client, as we probably should call everybody that comes to our office. But so it's about a relationship, and that's what I find most interesting and what gives me the pleasure and the gratification.
And I have peers and family members who actually see you as a primary care physician, and you're very comfortable to be around. I just like listening to you right there, and it's just you just have this openness, and like you said, another thing you do is holistic well-being. So you treat the whole body. You maybe take a little bit more time than we're used to at a regular doctor's office. Maybe a doctor who's got a full schedule. I know you have a full schedule too, but is that true? Maybe take a little bit more time, look at the body as a whole.
Yeah, yes, we do. We kind of will get into your family. We'll try to delve into some other things that are really bothering you, and that takes time to get to know somebody, to get to know what makes them feel well, or what actually is their driving force, what makes that person. So and everyone, as you know, is so unique and so special. So no two persons can be treated the same way, and I try to make it very, very, very much, individualized care. So nothing for one person doesn't mean that the other, that same procedure or treatment plan is the same. It should be as the same way as as the other person. So it's challenging in that way, and it makes it interesting too.
And you made a perfect point there. A very important point is family, because with the conditions that patients are coming up with, or diseases and etc., there's a lot with the family history, genetics, and as a primary care physician, I mean, that's something that is very important, because you get the patient coming to your office. At first, it's kind of like a puzzle, isn't it? You got to figure out exactly what's going on and how you can help, and you come up with your own plan. So family history has got to be really
family
important.
History is extremely important. It is part of the genetics of every person. So even asking a person who is 75 years old, it still becomes important. What were your parents? What was their what were they? What did they fall ill to? If they have passed away already? So a lot of things come into play. So it's a very complex matter, and certainly one visit doesn't even attempt to classify everybody. It takes several visits. I tell you, over many months to actually get to know a person and kind of feel what the best approach is with them. So it's exciting for that, and I always tell the patients, when you come to my office and you come to the practice, always feel free to, if you have a question or if you feel uncomfortable in a certain area, to let me know and try to open up those doors and that exchange, which is really where we get our healing and our wellness is in actually exchange. So that's where the results come from.
I wanted to save this question for later, but I think this is a perfect time. I know it differs for each individual, but how often should we be seeing a primary care physician, a family practice physician? Is it twice a year, once a year if we're really healthy, maybe 4 times a year if we're on some kind of plan?
It is a varied thing depending on one's health and age. Of course, the younger you are, barring that you don't have any other, any problems, but a once a year checkup is a very important thing. When you check your blood pressure, your weight, are you within the normal limits of all these things? Is your your cholesterol's all right? Is your thyroid is okay? So we check those things as people are in the younger years. Are you exercising? Are you doing the right things? Are you smoking? All those things are, all these things that you're doing, as young people matters. And so we ask you these things. So, a 25-year-old who's coming in who says, I'm pretty healthy, I have nothing, you'd be surprised. And you check their cholesterol levels and they're quite not all right. Their cholesterols are high. And that could lead later on, if ignored, to, blockages in the arteries or other, diseases that might hinder their life in when they're 40. So that's important. So then, as you get older, that's depending on your diagnosis, whether you've been diagnosed with hypertension or diabetes, then then your plan is structured. Maybe you come in, every 3 months and you get a checkup and you get some blood work done. It varies depending on your overall health and status at the time.
And is that preventative medicine that you're talking about? Yeah. It's better to nip it in the bud now than have a problem way down the road when it's kind of almost too late, right?
Yeah, absolutely. I mean, and I'm a firm believer that if we can prevent a disease, the better we are. And that goes for prevention across the lifespan. When you're 20, when you're 40, when you're 60, when you're 80, you've got those health prevention matters and health changes and lifestyle changes that are appropriate and important to you are important at whatever age. So that's where we're coming from that. So
we're here with Dr. Vivian Carta-Sanchez, internal medicine, geriatrics, holistic well-being with Tenet Florida Physician Services. Your office, I got to tell you, is in a great location. It's 5405 Okeechobee Boulevard, Suite 100, West Palm Beach. The reason I say that, I haven't been here yet, but everyone's talking about it's just east of Zaxby's. Yes. Chicken fingers and wings.
Dunkin' Donuts is right there. We've got
I know you don't want us going there all the time, but every once in a while it's got to be okay. I haven't been there yet, but everyone's talking about it. And then you're just west of Haverhill, which huge road in West Palm Beach. I play guitar, so the Guitar Center's right there.
Right there, yeah.
And then right a half mile east of Florida's Turnpike. I mean, your location is just awesome.
No, it is an awesome location and a very nice building, and
it is
very, very nice. So it's easy to get to because of great parking. You just park and you're there, so it's very easy. And we also have the advantage of having a diagnostic center right in front of our main.
Oh, I didn't know that.
Yeah. So, if you need a mammogram or you need a chest x-ray, it's right across the hallway. So then they're very nice because they take care of our patients pretty well.
Hold that thought about mammogram because we're going to talk about that on the other side. Okay. But Dr. Vivian Carta-Sanchez here. She's an ARNP and DNP. And then also her number is 561-697-3131. Or you can find more information on her at tfpsdocs.com. That's tfpsdocs.com. That's Tenet Florida Physician Services. And on the other side, I wanted to ask you a few questions about breast cancer screenings, which right now is October's Breast Cancer Awareness Month, and we're going to get a little bit deeper into internal medicine, geriatrics, and wrap it up with holistic well-being on Doctors Are People Too.
My dad is a cardiologist, and so I have two brothers, and we're all equally painful to my mom. And so to get us out of the hospital, we would go on rounds with him on Saturdays and Sundays in the hospital back in Oklahoma City. And we used to, race wheelchairs down the hallways from the time I was about 6 years old. When I was a freshman in high school, I got to watch my first heart transplant. But I think what really kind of made me want to be a doctor was around the holidays. The house always filled up with tons of gifts from thankful patients, and to impact people's lives like that in a positive manner was something that was very exciting to me. I'm very patient-oriented. I care about the patients both professionally and personally, and not only about their result, but also that I'm passionate about new technologies. I'm passionate about research, and I'm passionate about offering them the best technology available with the lowest risk and with the best outcome. What you want in a physician is someone who is personable, works as a team, embraces new technology, is clearly accomplished, but I think most importantly is somebody who you get confidence in, and the way I would have confidence is if I had a condition, I would read as much about it as I could before I showed up, probably off the internet, and then ask very directed questions. I do a lot of exercise. Running is what I use to kind of calm my brain down and kind of sort my thoughts out. So I enjoy, I just will put my shoes on and go for a run, and then I do mix in a little bit of yoga, something probably not many people know about me. I keep that on the down low, but so I do some yoga, and I go to the gym like most people.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
And we're back on Doctors Are People Too with Dr. Vivian Carta-Sanchez, ARNP, DNP, with Tenet Florida Physician Services at 561-697-3131. Doctor, I wanted to ask you, because it's very timely, October is Breast Cancer Awareness Month, and just from a doctor's point of view, what do you tell your patients about screening for breast cancer?
Well, for women, mostly, those are the ones we mostly deal with. However, men do get, breast cancer as well. But for women after the age of 40, it is now thought of that every 2 years, one should have a mammogram, a screening mammogram, checking for any, abnormalities. And so that's it used to be a year thing, but now we're finding that every 2 years is suitable. However, if you've got a history of family history, a strong family history with a mother or sister that has had breast cancer, then perhaps your doctor would recommend a yearly exam. Of course, we're always recommending your own personal checkups as well when you do your own personal checks on your own breasts, so that you don't, if you do find a lump, that you immediately get to your primary doctor or gynecologist to evaluate it. So certainly that's number one, and then the mammograms. So
now, can obesity lead to breast cancer?
Yeah, apparently there's a link. Not a direct link, but there seems to be a link with that. So that is another factor. But certainly now they're even saying perhaps even there's not as strong as a family history as they thought, but there's always the possibility. So regardless of where you are, who your parents were, what's your family history, you need to be diligent on those screenings. And again, it's a prevention thing about maintaining wellness. I had a patient the other day who actually she said she felt a very tiny thing. Then she couldn't find a tiny thing on her breast, and I did the exam, and I could not tell. And I said, well, let's do a check. She was a little 50. So I, sent her to get a mammogram, and she was found to have an abnormal mass. So, I could have sworn that I didn't feel anything, and I really did a thorough, diligent exam, and so the mammogram picked it up. So, these machines that we have developed are very exact, and they find things that our human hands and eyes and ears can't pick up sometimes. So we have a privilege to live in the time we are.
And it's great to have a primary care physician that you can talk to, and then if you see something, she's very proactive. That's preventative medicine. Obviously, we talked about before. I want to talk to you about another topic that's in the news, is the flu shot vaccine. And I wanted to ask you, I just got mine. We talked a little bit about during the break. It's never hurt me. If anything, I get a little muscle ache the next day where the shot, but nothing that would keep me out of work or keep me from moving around. But why is it important to get the flu shot every single year?
Yep. Well, it is important, especially those who have illnesses or they're older than 65. But regardless, it's now recommended for most of the population, because we are. Have you ever had the flu? It's not a good thing.
No, it's not.
The flu is a very serious illness. You get extremely sick. You cannot move. It's not the common cold that a lot of people say, I got the flu after I got the shot. No. It's a type of thing that puts you in bed. It gives you a very high fever. You feel like a truck really ran you over, and you're aching all over. So it is a very debilitating thing. So if you can prevent with a vaccination that is relatively safe, I mean, and I say relatively because there's always our cases, but in general, for the most of the population, it is a safe preventative vaccination that helps you stay away from getting the flu. So it's recommended. And people who are involved with taking care of older people who are involved with children, we've got germs everywhere. People who are involved with people, which is probably everybody, who are exposed to, talking with people, handshaking, you're exposed. So if you can prevent yourself from getting an illness such as what is the true flu, then you've done yourself a big favor. So I recommend it. So everyone should be brave and do it, and there are, but of course someone will say, oh, I got the flu afterwards. Well, but if you ask them exactly, did you really get the flu or did you get a cold? There's a big difference.
Like you said, when you have the flu, I mean, you can't get out of bed, the body aches. I mean, I've had it a couple times, and you made a outstanding point is the loved ones were around, older people. If we don't get the flu shot, we could be giving them a nasty strain. Worse still, our bodies, our immune systems are pretty strong at our ages. But someone who, I know you take care of a lot of geriatric patients, someone at that age doesn't have the immune system
Absolutely.
to fight it off.
A flu, infected with the flu can actually kill somebody who's older, who their immune systems just can't react as fast, and they can die. I mean, we had the cases back. Every year, there's cases of flu, and people die from it. So,
well, let's stay on geriatrics for a second. Thank you for sharing everything on the flu. I think it's important just to get people the knowledge out there. Let's stay on geriatrics for this a second. So, geriatrics. Is this start at a certain age? Is it after a senior citizen, or do you have to turn 80? I mean, how does it work?
Well, it's a good question. Very good question. When I went to school, my specialty was geriatrics. So I was, my schooling was particularly inclined for the older person. And at that time, that's about 20 years ago, the geriatric person was over 55. The person over 55. Wow. So, I wouldn't go around saying 55-year-olds are geriatrics, but that in my schooling, that was what it was. But geriatrics, as I see it, is a very unique population group that has a set of criteria, one being older, of course, and having had a certain experience in life. And then they usually tend to have certain comorbidities or different maybe diseases or ailments, if you want to call it that way, illnesses that might be more prevalent in the older person. So we try to keep them at bay, and some of them become chronic, and we deal with chronic illnesses in the geriatric world.
Now, when I think of the older population right now, I'm already thinking of baby boomers a little bit, and they're going to be the next to be, I guess, in the geriatric, I don't know if I want to call it demographic, but
demographics, yeah. The baby boomers are heading all in that direction. I mean, I don't know what the statistic is, but every day, I don't know if it's some number like 25,000 persons be turned 65. But
wow.
Of course, 65 today, as opposed to 65, turning 65, 50 years ago is a lot different than it was. So, people are generally healthier at 65 today. They've had better nutrition. They're just stronger. And of course, hopefully they have access to health, to wellness and prevention of diseases. But anyway, that's our population is growing in that older age. It's a big group.
When I think of baby boomers, the first thing I think is my parents. They're both baby boomers. And then I also think of all the medicines. And then I think of watching TV on any given night and seeing all the drug commercials. Is that something a primary care physician can help, is manage those medicines and kind of
Absolutely.
Steer them on a correct path, working with other, referring physicians?
Sure. That's where, we're the home base kind of thing, or the primary care is the home where you get your basic advice, you get your basic information. And if that provider, physician, nurse practitioner, PA finds that you have an issue with a kidney or your diabetes is out of control, then we send you to the specialist depending on what it is. So that's where your home base is, and then you should feel, a client of ours should feel comfortable. Write a list of questions when you go to the doctor's office or your nurse practitioner, and ask those questions and have a very keen sense of why you're there and your goals, the person's goals for their health. So those are important questions to ask yourself when you go to a primary care office, and then you move forward with whatever comes out of that. So.
I never did that until recently, and it really worked because I had all these things I was wondering about, and I had like 10 questions, and the primary care physician ripped right through them, and we ended up being like there for like a long time. We got through everything, all the questions I ever had, and I felt really good because I finally got to ask my questions, and some of the answers weren't right on site and testing or whatnot, but that was really helpful. I never listened to that until recently, and then you said it right there. So
absolutely, yeah, you're going there for advice and as a team, because the physician or nurse practitioner might give you an idea about something, and I see the person's input, the client's input is as important as sometimes as mine, because I learn a lot from them too. So
that's important.
Yeah,
and you're really easy to talk to. We're here with Dr. Vivian Carta-Sanchez. The number of her office is 561-697-3131. Very easy number. I've already memorized it.
It is an easy number, you're right.
And you can see all of her education and certification, areas of interest, professional affiliations on tfpsdocs.com. That's the letters tfpsdocs.com. And we talked about before, you're at 5405 Okeechobee Boulevard, Suite 100. See, I did memorize it all.
You did. Wow.
They're just east of the Turnpike on Okeechobee Boulevard and just west of Haverhill Road. You can't miss it on that north side of the road. Now, I wanted to get kind of wrap it up with a few topics. Internal medicine is the first thing listed on your bio, and when I think of internal medicine, I actually think of the heart, maybe diabetes, maybe other possible ailments. Is that what internal medicine, what you see, what patients see you for? Is it, can you help people, with pre-diabetes? And I guess when you listen to someone's heart, when you take the stethoscope, are you listening for maybe atrial fibrillation or something? How does that work?
Yeah. Internal medicine really is that. You've said it. The hypertension, the diabetes, the thyroid disease that might be there. Heart abnormalities, heart rhythm abnormalities, all that is part of our assessments, as is, musculoskeletal system. We look at the bones, the muscles, the osteoporosis, the bones, health of the bone. So that's all part of it. And then, of course, you've got also part of the internal medicine very importantly, is the brain function. How is the brain working? How is your memory? Are you depressed? Are you anxious? Are you sleeping well? So it's all part of internal medicine. So it's kind of like the whole body and internally, So.
And you're also bilingual as well. I think that's important to point out. English and Spanish.
English and Spanish. Yep.
Nice to know, because as we are an aging population that we talked about, we're also a population of people from many different walks of life and people from all over the earth. So that's important.
Yep. So wish I knew more languages, but I do Spanish and English. Of course, I am bilingual, so it does help me a lot with the patients from other countries.
That is great to know. And I just want to give out your info one more time. I know we just have a minute or two left on Doctors Are People too. So it's Dr. Vivian Carta-Sanchez, 561-697-3131, tfpsdocs.com. That's tfpsdocs.com. Nice office there, 5405 Okeechobee Boulevard, Suite 100 in West Palm Beach. Now, I know we just have one more minute, so I wanted to ask you a little bit about, what do you do outside of medicine? I mean, you spend a lot. I know your primary care, you see a lot of patients. But do you have any hobbies or passions and interests?
Yeah, I do. Thanks for asking. That's very nice. I do Zumba to try to keep myself in fit. So I really enjoy that on weekends. So I do that, and I also horseback ride.
Really?
So yeah, and but just for pleasure. I don't do any of those high jumps that other people do, but just for pleasure, horseback riding and trail riding.
Wow.
So I do that for fun.
I never know when I answer that question what I'm going to get. It's always something you least expect, but
Yeah.
that's really neat.
Yeah.
I mean, you get outside a lot and you actually exercise a lot,
Yeah.
which is important to your
great-
well-being.
Yeah, it's a great stress reducer. You know, when I ride, it's like you're outside, you're nature, and it's quiet, and you can have a breather. So
And I noticed, I try to get out as much as I can. I'd like to get out more, but the mountain bike trails that I go out to, West Atlantic Park, way out west on Atlantic, I thought I saw some horse trails on the perimeter near the
yeah.
canals there.
Oh, yeah,
And then
yeah.
some guy stopped me because I was looking at it, and he was like, hey, do you know this is connecting to this trail over here, and eventually it's going to go all the way to the Everglades and this and that.
Yeah.
Like there's some great horse trails that you wouldn't even know about.
Yeah, absolutely. And I live in Wellington, so west
Oh,
of
wow.
that we have a lot of horse trails, but in an area that you could go ride your bike and skateboard or whatever. And then on the perimeter you have the horse trail, so you can go and bring your horse. And so yeah, Palm Beach County is great. We have no excuses for not being outdoors because
And
we
you
have a
have all
lot of
the-
places to have fun.
And the polo out there too.
Right.
I've never got a chance
Oh,
to do
you
that,
should
but
go. You have to go.
and I'm a
It's-
writer, and I always was like, man, I want to cover that one time.
You
You know,
definitely would enjoy that.
Yeah.
The polo and the equestrian events, the jumping.
Equestrian,
and
yeah.
they have the world's best out there, so it's definitely worth a visit.
yeah, I'll watch that in the Olympics, but I didn't see it this year. I don't think it was in the Brazil games. Maybe I
It
missed
was.
it.
It was.
It was.
Yeah, it's
Okay.
just- I don't think it gets prime time.
Yeah.
Footage
That's one
and
thing I
coverage.
would love about the Olympics. You get a taste of all the different sports that you would never. I mean, someone like me who's never been on a horse.
Well, then you need to go out to Wellington and go check it out.
Yes,
You'll love it.
I'll go on a slow one, a very
Yeah,
slow
you
one.
Could, you could.
I know out in the acreage too, in Loxahatchee, they have the horse trails, and where I'm from, Jupiter, out in Jupiter Farms as well. I
Oh,
see them on
yeah.
the side of the road, so we're in a really great area to get outside and horseback
Absolutely.
ride.
Yeah, it's great.
Wow.
So it's I don't know how much cardiovascular I do, but at least I'm out there enjoying the.
Well,
the
Zumba.
scenery.
I mean, you're
and
in
then
great
the Zumba
shape.
covers
So
the cardiovascular.
yeah,
so.
Zumba. Yeah.
So yeah, I always like
couldn't
to
do
plug.
that.
I always tell the patients you got to have at least 150 minutes of a good cardio workout where your heart's beating, a little bit faster than normal. So
Per week.
per week.
Oh, wow.
That's what the study showed.
That's
that
five
keeps you
30-minute
Right.
periods a week.
Yes.
Wow, that's good to
So
know.
Whether it's bike, a walk, a swim, Zumba, or
Get the heart rate
you
up
got-
for 30 minutes straight 5 times a week.
Yes.
Wow. Any men in the Zumba class?
There's
I look
one
funny in there?
gentleman. There's actually one gentleman who is great. He never fails. He's always there.
Smartest guy out there.
So yeah, he's very nice.
And he's heart healthy. Well, thank
Super.
you so much for coming on Doctors Are People, too. I think we really got across a lot of topics that are important. And I'll give out your number one more time, Dr. Vivian Carter Sanchez, 561-697-3131. And please come on the program again.
Thank you. I'd love to, and I appreciate your interest, and hope to be around again. So I'd love to do that. Thank you.
Thank you.
Hi, my name is Dr. Rahul Agarwal. I'm an interventional cardiologist in Jupiter, Florida. I did my medical school at the University of Florida and my internship and residency at the same program. I did my chief residency also at Chance, and then did my cardiology and interventional cardiology at Wake Forest University in Winston-Salem, North Carolina. I specialize in general cardiology, interventional cardiology, and nuclear cardiology. Even though I'm an interventional cardiologist, the majority of my practice involves general cardiology. General cardiology is a pretty broad spectrum in that it involves rhythm problems such as atrial fibrillation, heart disease such as coronary artery disease, congenital heart disease, high blood pressure, and cholesterol problems. I do procedures such as cardioversions, which involve trying to convert the patient back to a normal rhythm if they have an arrhythmia. I also deal with plumbing problems such as the coronary arteries, which if they're blocked, I can do angioplasty and stents, which involves balloons that open up the arteries. And these stents act as scaffolds that keep these arteries open. I really do believe in preventive medicine, and one of the areas that I really focus on is diet. One can really get caught up on the pills aspect and the exercise. And diet we talk about a lot, but unless one really has some guidance as to where to go with diet, it can be quite difficult. So I do give my patients homework in terms of books or movies that they can rent or obtain so that they can get educated. Our cardiology office is located in the Abacoa area of Jupiter, Florida, conveniently located between two of the local hospitals. We provide echocardiography, stress testing, ultra monitoring, and general cardiology office visits. We really pride our practice in its staff, who are very courteous and professional. We believe that under our care, you'll feel the same way too.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
And welcome back on Doctors Are People Too. I don't want to waste any time. Our next guest, Dr. Aliyah Abdullah, is a surgical oncologist with the Center for Advanced Surgical Oncology. And right now, October is Breast Cancer Awareness Month. And I know that she is available for treatment of breast cancer, which is oh so important this month. Dr. Abdullah, how are you doing tonight?
Hi, how are you? I'm fine, David. I'm doing well. Thank you for having me on the show.
And thank you for coming on Doctors Are People Too. I want to get right into it, but I want to tell listeners a little bit more about you. You're the Medical Director of Surgical Oncology at North Shore Medical Center in Miami. North Shore Medical Center is located at 1100 Northwest 95th Street in Miami. I've been there a few times. It's just, it's very close to I-95, easy to get in and out of. The number there is 305-835-6000. That's 305-835-6000. And the website is northshoremedical.com. Dr. Abdullah, October is Breast Cancer Awareness Month, and we know in past years that mammograms were recommended for women on an annual basis every year. And I was doing a little research for the show, and I saw in some information that is every other year. What do you suggest for mammograms coming from a physician point of view?
So it is very dependent on your history. Most of the time it is still recommended yearly. However, in patients, and yearly mammograms have significantly reduced the amount of advanced breast cancer that we see today. Most of the time now, when we diagnose breast cancer, we typically will diagnose them at a stage 1 or an early stage breast cancer. And those types of cancers are very treatable. And so mammograms were first recommended yearly because of this decrease or this ability to find breast cancers very early. I would still recommend mammograms pretty much yearly, but depending on the patient's history or your history, it could be a little bit less than yearly. But it's strongly dependent on your history, whether you've had a breast cancer in the past, whether you have a history of breast cancer within your family, and whether you've had other types of cancers running in your family.
Now, what does the actual mammogram read? Is it testing for a mass? I mean, from a clinician point of view, I mean, what is the test for?
A mammogram can actually detect more than just a mass. It is an X-ray. And it's sort of an X-ray of the breast. And on X-rays, you can see any hypo or hyperechoic density. And so even something we call calcifications, which are sort of calcium deposits that can develop in your breast, can be seen on a mammogram. And so it can detect a mass, but it also is there to detect early signs of breast cancer. And so we know that calcifications can be associated with a breast cancer in about 30% of the patient population. And so if we see calcifications, then that may be a sign that we have to do more testing.
So take me also through the process a little bit. Does a radiologist read it, and then if they see a mass or a lump or that, kind of calcification that you're talking about, what's the next step? Is the primary care physician notified, or are you as a surgical oncologist notified at that time?
So I would not necessarily be notified right away. It depends on who ordered the test. So immediately the physician that ordered the test would be notified. And then it's up to that physician to direct you to the next step. And so most of the time, screening mammograms are not typically ordered by myself. They're ordered by your primary care doctor or your OBGYN. And so once your physician orders the test, they typically will get the results. And so a radiologist that reads the exam will notify that physician, and then that physician will direct you as to whether or not you need to see a surgical oncologist or someone that is more specialized.
Perfect explanation, Dr. Abdullah. Thank you for that. That made it much more understandable for actually myself, but I hope, my novice into it will help people, driving around their cars listening, or later on watching this on YouTube or the link. Now, as medical director of surgical oncology at North Shore Medical Center in Miami, what can you tell us about the options available for breast cancer at the hospital?
So we offer an array of treatment for breast cancer. Once a breast cancer is diagnosed, it's important for myself. I typically will discuss the diagnosis with the patient. Now, there are a lot of details that will go into choosing the option that's right for you. And so the options vary from deciding on doing something we call a lumpectomy versus something we call a mastectomy. And that just basically means removing a part of the breast or removing the entire breast. And I know that a lot of these options, when you hear them initially, it's very scary. And so part of my job, or at least part of my job that I see what my job is that I seek to make sure that you as the patient is comfortable with your decision and you truly understand what the options are before you make the decision. And so sometimes that can take one visit with me, or sometimes that can take 2 or 3 visits with me before you make your decision. But really, it's more important to know all of your options and understand all of your options before you choose them. And again, there are options.
Now, Dr. Abdullah, at that time, is there any opportunity sometimes for a breast reconstruction specialist to come in and work with you? Maybe if that individual chooses that they want a reconstruction, is that something that you work like on a team with, I guess? Is that a plastic surgeon, reconstruction specialist?
Definitely. So that is an option, and especially in certain patients that have significant family history, or if they may have genetic factors that affect their breast cancer. And we sometimes do offer mastectomy or removal of the entire breast with reconstruction options. And I work closely with plastic surgeons in Miami that do amazing reconstructive procedures.
That's so important for quality of life. I'm glad you mentioned that. We're here with Dr. Aliyah Abdullah, surgical oncologist with the Center for Advanced Surgical Oncology in Miami. And hi, Aliyah. The number, that's her office, Center for Advanced Surgical Oncology. The number is 305-820-6657. Or you can find her online. You can read about all of her certifications, board certifications, fellowship training at tfpsdocs.com. That's tfpsdocs.com. And Dr. Abdullah is also the medical director of surgical oncology at North Shore Medical Center in Miami. The number there is 305-835-6000, 6000. And website is northshoremedical.com. Dr. Abdullah, I know that you're a surgical oncologist and that breast cancer is a surgery you do perform or treatments, I should say. What other types of cancers do you treat? I know that's a big question, but I think it's important to get kind of a listing of everything that you do out there.
So I do treat a wide variety of cancers. In addition to breast cancer, I treat skin cancers, including melanomas. I also treat soft tissue cancers, including sarcomas. And then I also treat gastric, so stomach cancers, colon cancers, rectal cancers. I also treat thyroid cancers and parathyroid cancers. And I also do head and neck cancer. So sort of a wide variety.
Wow, that's a lot of areas of interest. And you are, I read on your bio that you're fellowship trained. Can you tell us a little bit more about that? Because I think that may give us a little insight to why you treat so many different types of cancers.
Yes, definitely. So I've actually done additional training after the main surgery training that most physicians go through. I've done additional training, which was an additional 2 years, in which I only specialized in operating on patients that had specific cancers. And so that training is from an NCI designated Society of Surgical Oncology approved training program. And that's important to know because there are a lot of physicians that may or may not treat cancer. However, the organizations that I mentioned are the ones that are the ones that put out most of the accepted recommendations pertaining to cancer treatment. And so me coming from one of those programs basically says that I have trained under the people that make those guidelines, and I basically have spent extra time performing surgeries within cancer.
Wow, that is so great that the way you explain that, because sometimes when the common individual like myself, we see fellowship training, and I think it's something we should ask our doctor about, but I think it's not something that everyone in the general public knows. I want to ask you, same with board certification or board certified, when we see that, what's the process and why is it important to choose a board certified physician?
So a board certified physician means that they've gone in front of their peers and they have become board certified because they have performed certain criteria that has deemed them personally that they have practiced medicine or their specialty, in my case, practiced surgery and surgical oncology to a standard in which others do accept them. And it's important to note that it's their peers that accept them, because so it's other people that would know the standard treatments for surgery or the standard of care for cancer treatment. And they basically board certify a physician to say that they are competent, they are treating patients according to these standards.
And we're here with Dr. Aliyah Abdullah, surgical oncologist with Center for Advanced Surgical Oncology, 305-820-6657. She has an office with the Center for Advanced Surgical Oncology in Miami, on the campus of North Shore Medical Center there, and then also an office in Hialeah on the campus of Palmetto General Hospital. The number's 305-820-6657. And also Dr. Abdullah's website, tfpsdocs.com. That's tfpsdocs.com. You can find out about all the fellowship training and board certification and areas of interest we've been talking about. And Dr. Abdullah is also medical director of surgical oncology at North Shore Medical Center in Miami. That's at 1100 Northwest 95th Street in Miami. It's just off of 95. I've been there a few times. Easy to get in and out of. The number there is 305-835-6000. That's 305-835-6000. And the website is northshoremedical.com. Dr. Abdullah, do you perform robotic surgery? That's something I'm so interested in, and I think it's something that's just come to the forefront, but I know that's not actually true. It's been studied for a little bit now. But do you perform robotic surgery?
I do. I do perform robotic surgery, not specifically to breast cancer, but other types of cancers that I treat. I do.
That is so neat. What is robotic surgery? And then I guess the second part of my question would be, what types of robotic surgery do you perform?
Okay. So robotic surgery is basically using a specific instrument, and we call it a robot in the operating room, using that specific instrument to aid in performing the surgery. I think it's important to note that it's never just the robot doing the surgery. It's always the physician that controls the robot to aid in performing the surgery. And so one of the main benefits of using the robot is that patients tend to go home faster. They tend to have less pain. They tend to recover much quicker than in prior surgeries where you've had to make big incisions. And so really that's how the robot is very useful, because in the past we've had to, for example, take out to resect a stomach cancer, we've had to make a large incision on an abdomen, on a stomach. And so with the robot, we're able to make smaller incisions and utilize a camera and then carefully perform the surgery. The patients end up having very small incisions on their abdomen. They end up having less pain. They don't need to take many pain medications. And then they end up recovering faster, meaning they start eating faster, they're able to walk faster, they're able to go home faster. And so it's actually a great new technology. And yes, like you said, it's not absolutely new. It's been in use for many years now. But it's a newer technology, and it's a great new technology.
And you said it's minimally invasive, and that's so important with getting someone in and out of the hospital in a quick manner. Now, do you use the DaVinci robotic surgical system at all?
Yes, that's exactly the system that I was speaking about. It's the main robotic system that is available, and it actually it's the only robotic system that's available today, and so that is the system I was talking about.
Okay, great. I didn't know that. So I actually have a quick story. I actually attended a surgery once where the DaVinci was used, and I can tell the listeners and viewers at home that the way the doctor explained it is perfect. Obviously, she uses it every day and is trained on it. But the way I saw it was the doctor's actually in a module, and I don't know if listeners and viewers remember the Nintendo module with the gyros, and the doctor's in that module, and they kind of almost use like hand joysticks, I want to say, and correct me if I'm wrong in a second, Dr. Abdullah. They're almost like gloves, and you're using the module, and then it's a laparoscopic robot that is very close to the patient, and like you said, goes in minimally invasively. Is that did I kind of get that right?
More or less. It's a little, maybe a little bit more complicated than that. But yes,
definitely.
It is somewhat kind of like that in terms of describing it.
And minimally invasive, and isn't that one of the most important things about robotic surgery?
Yes. The fact that it's minimally invasive, you can, a lot of times the patients can return to having to start eating the next day. They don't have as much pain because there's not a huge incision on their abdomen. Instead, they're very small incisions that we use. That's the key part, is that it is minimally invasive.
Now, we talked about laparoscopic briefly. You have an FLS certification, Fundamentals of Laparoscopic Surgery, if I'm correct. Why is it important to have that certification under your belt there as a surgeon?
That is a very important certification in terms of performing surgery nowadays. The most important thing is trying to perform surgery while the patient in the best manner possible. And there's a lot of data that has shown that performing certain surgeries in a minimally invasive way, and we use the term laparoscopic, that's the term that also implies minimally invasive. When we do the procedure in that manner, the patients are able to recover much faster. And so it's a different way of performing surgery. It's a different feel, and most patients recover much faster. However, it is important to go to a surgeon that is well trained in this field.
We're here with Dr. Aliyah Abdullah from the Center for Advanced Surgical Oncology, 305-820-6657, tfpsdocs.com. That's tfpsdocs.com. Dr. Abdullah is also Medical Director of Surgical Oncology at North Shore Medical Center in Miami. North Shore Medical Center is located at 1100 Northwest 95th Street in Miami, just off I-95. The number there is 305-835-6000 and northshoremedical.com. Dr. Abdullah, I want to thank you so much for coming on Doctors Are People Too tonight. Very timely interview with October's Breast Cancer Awareness Month, and I can't thank you enough for ripping through all those topics on cancer. I know it's something that we got to get the word out on, and something that's very important. So thank you so much for coming on Doctors Are People Too.
Thank you for having me. It was a great pleasure.
Yeah, and please come on again in the future. I really appreciate it.
Okay, I would love to.
All right, thank you. And we'll see you next time on Doctors Are People Too.
Thank you for listening and watching Doctors Are People Too with David DiPino. Join us next week for more in-depth views on what doctors are all about and how they spend their free time. All shows can be seen on amp2.tv. And if you have questions you want answered on the air, call 866-224-5422 and leave a message that can be read on the air. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those